Welcome back to Ask Dr. Danett, where I answer one women's wellness question from an Eastern medicine perspective. Today's question is, should I be concerned about heavy periods? Well, this is a really important question, and the short answer is yes. Heavy periods are something that deserve attention, but there is more to be considered. One thing I think is important to understand is that what feels heavy to one woman may not feel heavy to another. For example, a woman who normally uses 1 or 2 pads a day during the first few days of her cycle may notice that she's suddenly using 3 or 4. That change would likely feel significant to her because it's different from her normal. Another woman may routinely use 3 or 4 pads a day during the first few days of her cycle. For her, that same amount of bleeding may not seem unusual at all. It's also important to recognize that the type of menstrual product you use can influence how you experience your flow. A woman who typically uses panty liners may suddenly find that she needs pads. A woman who normally uses regular pads may find herself needing overnight pads or changing them much more frequently. These kinds of changes can be important clues that something about the menstrual cycle has shifted and deserves attention. This is why it's super important to understand both what is considered heavy bleeding clinically and what is normal for your body. A significant change in your usual pattern is something worth paying attention to. There are also clinical definitions of heavy menstrual bleeding. On average, menstrual blood loss is typically estimated to be about 30 to 80 milliliters over the course of an entire menstrual cycle. Blood loss above that range may, not always, but may be considered to be heavy. For women who use a menstrual cup, this can sometimes be easier to appreciate because the cup has measurement markings. For example, if a woman is accustomed to filling her menstrual cup once a day and suddenly finds herself filling that same cup much more quickly, that change may be an important sign that her bleeding pattern has shifted. Again, while definitions can be helpful, it's super important to pay attention to what is normal for your body and to notice when significant changes occur. Generally speaking, a period may be considered heavy if it begins with a gush of blood, it catches a woman unaware, it requires frequent changes of pads or tampons or other menstrual products, or significantly interferes with daily activity. From both a Western and Eastern medicine perspective, heavy periods are something that deserve attention. Western medicine often looks at the amount of blood loss, how frequently menstrual products need to be changed, whether bleeding interferes with daily activities, and whether symptoms such as fatigue or anemia are present. Eastern medicine also pays attention to the quantity and quality of menstrual blood, but we look at it within the larger context of a woman's overall pattern of health. We ask questions such as, has the bleeding changed? Is it accompanied by fatigue? Do you feel depleted after? What other symptoms are present? Even the shade of the blood can give some information. In other words, we're not only interested in how much blood is being lost, but also what that blood loss may be telling us about the body's overall state of balance. Heavy bleeding can occur for a variety of reasons. It can be part of the picture during perimenopause. It can be associated with fibroids. Sometimes a woman may have fibroids and heavy bleeding, but the fibroids may not necessarily be the primary cause of the bleeding. This is one reason why it's important not to make assumptions and instead work with a healthcare team that can help identify what's really going on. Now, from an Eastern medicine perspective, we say that blood is the mother of chi. Chi is often described as the body's vital energy. When a woman experiences significant blood loss month after month, it can affect the body's resources. Over time, this may contribute to fatigue, decreased resilience, and a feeling that the body simply doesn't have the same reserves that it once had. This becomes especially important during perimenopause. During this stage of life, a woman's yin energy naturally begins to decline. Yin is associated with cooling, nourishment, restoration, and balance. Blood and yin are closely related in Eastern medicine, so when there is significant blood loss over time, it may affect how a woman experiences the perimenopausal transition. Clinically, I've often seen women with a history of very heavy bleeding struggle with symptoms such as hot flashes, feeling overheated, feeling more depleted, especially during perimenopause. And while every woman's experience is different, it is another reason why paying attention to heavy periods is so important. The good news is that heavy periods are not something you have to ignore or simply accept. They are your body's way of communicating that it needs some support. Pay attention to what you're experiencing. Notice whether the heavy bleeding happens every month or only occasionally. Stay hydrated. Track your symptoms, and most importantly, make sure your health care providers are aware of any significant changes in your cycle. I believe women do best when they work with an integrative healthcare team because we are multidimensional. Different healthcare perspectives can provide different pieces of information that help us better understand what the body is communicating. So, should you be concerned about heavy periods? Yes. But it's not to panic because it's your body giving you important information. The sooner you pay attention to that information and seek appropriate support, the better positioned you will be to protect your health and well-being. If you have been diagnosed with fibroids, are concerned that your heavy bleeding may be related to fibroids, or have had fibroids removed and are looking for ways to support your wellness, I invite you to download my free fibroid support guide. Inside, you'll learn more about fibroids and discover supportive strategies rooted in Eastern medicine to help you take a more active role in your health and well-being. You can download your free copy using the link in the description below. And as always, if you have a question that you want answered in a future episode of Ask Dr. Danett, please go to the link in the description below. Thanks for joining me, and until next time, love being a woman.